We explored a lot of options with respect to providing patient education through video and television. And we got to the patient channel, and it was the closest we could find to what we really wanted, but it wasn't exactly what we really wanted. And so we were able to work together with the managers and the programmers at the patient channel to create a custom channel where we can hopefully seamlessly blend in our own locally produced programming with that provided by the patient channel, and to turn it into something more Willis-Knighton specific.
We are more and more mandated by the government, Medicare, the Joint Commission who accreditates our hospital to provide education, and WKTV helps us provide certain disease-specific educational pieces like congestive heart failure. Smoking cessation is required for all smokers who come in the hospital, and so this helps us to meet that requirement.
Well, I think it reinforces what we as nurses are trying to get across to patients or teach patients. If you tell them something and then they see it on TV and then they can say, hey, I just saw that on TV. It keeps that conversation going until they have it clear in their head. Sometimes they need it from more than one source before they believe what you're trying to tell them.
One of the biggest benefits for our staff is that they're bombarded with required patient education, mandatory education that has to be done. The patient channel allows us to present that to patients, and then the staff can discuss the issues and discuss the videos with the patients after they've had a chance to view that material. That saves our staff time, that saves our staff resources.
I mean, definitely WKTV helps a lot of the staff work more efficiently. Not only nursing, some of the therapists, rehab. It's less time that's spent with the patient, re-educating them on things that we don't have to. I mean, if they watch the channel on their types of surgery or surgical procedures, they don't have as many questions. They're not as apprehensive. They do better. They know what the goals are coming out.
We decided what specific programming we needed to produce for WKTV, and we created a priority list. And we thought it was important to use local people to do this. People have become very comfortable in seeing their own healthcare providers on WKTV. You will see Willis-Knighton physicians on WKTV. You will see Willis-Knighton nurses on WKTV, not only in a role of being interviewed, but as presenters, as people who are directly communicating with the patients, presenting those ideas.
I think it draws the patients in when they see familiar surroundings, the buildings, their rooms, the nurses that they might know or people that they know. I think it really catches their attention and makes them learn a whole lot more from the whole process.
We introduce the patients and their families to WKTV upon admission. There is a programming guide that is placed in the room when the room is prepared for the patient, and then when the nurse comes in to admit the patient, they review this with them, show them how to turn the TV on. It goes directly to the channel, and then they review the programming schedule with them, and that allows the patients and families to have a little time to digest the content, to prepare some more questions, and it provides it in a standardized way. So that's how they're introduced to it.
We have posters, webinars everywhere, even around the elevators, we have those.
We are providing patient tray liners with information about the patient channel so that they'll know while they're eating their meal, they see another reminder that the patient channel is available.
We try to keep the education channel going in our waiting room when we have patients there waiting, and we get comments from them. You know, I didn't know y'all had this, or, you know, that was a good program.
There are table tents that are on different tables throughout the hospital, and information is also available on our website that they can use while they're in the hospital or when they're at home.
The staff also have access to that information to know about what's the newest and greatest programming that's available.
We've had several patients who have made a lot of positive comments. Just last week we had a patient that was in with a staph infection, and she was particularly watching infectious disease doctor, and it was a day later that particular doctor was consulted and came into her room, and she was excited. She said, oh, well, I just saw you on TV. It's a big plus. It makes them feel more comfortable with the care that they receive and that is provided.
I actually did the other day. I was in a patient's room preparing for them to come in, putting their patient handbook in the room, and I turned it on the channel 95, the WKTV channel, and it was a smoking cessation program that was on at that time, and it was helping the patients to try and figure out what kind of road they had ahead.
I've heard them talking about it when you walk in the room with their visitor or their family member that's in there with them. So it's reaching beyond the patients, and that's a benefit to the hospital too, and to the staff, and to the family, and to the community, because they'll take those tidbits of information and share it.
If you're any kind of a patient advocate, you know you have to provide something, and you know it has to be quality, and you know it has to be evidence-based, and I see all those things in the educational channel.
Within this healthcare environment, everybody's forced to do more with less, and we have to continue to use technology in order to continue to elevate and improve care throughout our healthcare system.
A better educated patient is a patient that gets well much faster and goes home a lot sooner. And the way we're reimbursed these days, when they go home sooner, we have better financial outcomes. Financially, I mean, it's very little cost to us in doing some of our own programs.
The product is wonderful. Everyone who views the programs have been impressed with the professionalism and the content that is provided in such a beautiful manner.
I would recommend a channel like WKTV to any facility who had the wherewithal to do it, because I think it really enhances the offerings of the patient channel. With your particular health system, you can be very specific to what you identify as the needs of your patients and your visitors. And I think you can have the best of both worlds. I think you homogenize those two products and you come up with something that's really very special, and something that will serve your patients and your visitors very, very well.